Hello, everyone. I would like to welcome all of you this morning. Ted, thank you for coming. My name is Sani Manzavi. I'm the Chair of Joint Board of Governors for St. Joe's Home Care, St. Joe's Healthcare, and St. Joe's Villa in Dundas. We're looking forward to hearing an important announcement on the significant investment to support hospitals in maintaining the quality of care they provide through an additional investment this year in new capacity funding in the community as part of its alternative level of care strategy. I want to take a few seconds to especially welcome our speakers today, Mr. Ted McMeekin, member for Provincial Parliament of Ancaster, Dundas, Flamborough, Westdale, Mr. John Fraser, Parliamentary Assistant to the Minister of Health and Long-Term Care, and Mr. Matthew Green, City of Hamilton Councillor for Ward 3. It is my pleasure to introduce Mr. Ted McMeekin, member Provincial Parliament of Ancaster, Dundas, Flamborough, Westdale, to say a few words. Thank you, sir.
Well, good morning, everybody. How you doing? It's a good day. Anytime we can get together in a place like this and make an announcement as exciting as the Parliamentary Assistant to the Minister of Health is going to make in a couple of minutes, it's pretty exciting. Before we go there, I just want to thank Sunny, obviously, who's chairing here. Is Dr. Gose here? Welcome. Thank you. From Integrated Care at St. Joe's. Lori Lawson. Hi, Lori. Welcome. Rebecca Buckland. Hi, Rebecca. Welcome. Tanya Tom Massino. Hi, Tanya. David Higgins. Is David here? Yeah, I know he was planning to come. Maybe not yet. Kevin Smith couldn't be here. Winnie Doyle? No. Jane Launch? No? Okay. So I won't introduce those folks who aren't here then, right? We'll just, Sharon Pearson? No. Kelly O'Halloran? No. Councillor Matthew Green, one of my favorite councillors. Tom Pierce from the Lynn. Tom, thanks for coming this morning, and thanks for the good work you do. Who else we got here? Linda Haslam-Stroud?
I'm here on her behalf, Lori Grant.
Hi, Lori. Welcome. Welcome. Cyril Sconewell? Right. Welcome. Teresa Agnew? Okay, and from the registered nurses, Sarah Bosveld. Thank you. Thank you very much. So all these important people, I really feel honored to have even a small role of introducing my good colleague here. But let me meander a little bit first, because it wouldn't be fun if I didn't do that, right? You know, we do, as a government, 45 different tests for newborn babies. You know, screening for diseases and the like. And I've always believed, and I know John believes, because I read his report, palliative care, and John and I have been doing some work on palliative care together. We need to be dedicating those kinds of resources to our seniors. Their demographic is changing so rapidly, and we know that people want to age at home, ideally surrounded by the people that they love. Today's announcement has a lot to do with that, and people who love them, ideally, right, as well. So I understand what it means to be a senior, particularly with some challenging health problems. I'm a senior with some challenging health problems. And I can tell you firsthand, notwithstanding some of the shortcomings in the system, when you need health care, Tom, in this area, it's there. It's there. And you know, to all the seniors in the world, you need to know that our government cares deeply about you, and we're trying to connect all the dots. Everything from vaccinations to aging in place to, cleaning up the mess with alternative level of care beds because there aren't enough community facilities. That's what this announcement's about today. So I've worked with John for a while. He used to be the chief of staff for Dalton McGuinty, and he inherited that riding, deservedly so, when Dalton stepped down. And he's been a pioneer on the healthcare front as Parliamentary Assistant to the Minister of Health and Long-Term Care, a real gentleman, somebody who cares passionately, very, very passionate. You should read his report if you haven't already on palliative care. It is really an eye-opener. I was just, when I read it, and he was saying so many of the things that Matthew and I have believed in for years, you know, but he's putting it down on paper and challenging his own government to respond. And that's what good elected people do. They don't just show up. They actually do something, right? And John's one of those guys, and I love him for it. He's a good friend, the MPP from Ottawa South, and the Parliamentary Assistant to the Minister of Health and Long-Term Care, the always honorable John Fraser.
Thanks, Ted, for that very kind introduction. And, you know, I do want to say good morning to everybody. It's really great to be in Hamilton. I actually am sort of semi-Hamiltonian. My mom grew up in Hamilton. My mom's family, she's a Costi, so there might be somebody who knows a Costi somewhere in here. There's 8 of them. But they grew up at 11 Liberty Street, and we stopped off there this morning to see if anybody was home, but Hal wasn't home, and then David wasn't home across the street. They all have houses on the street. So I was really happy to be coming here this morning, not just to see Ted, but to be in my mom's hometown. You know, she's a nurse. She's 85. She's still a nurse. She may be retired. She still practices on the side whenever something happens in the family. We give her a call. We avoid emergency room visits. So that's actually the solution to primary care, is just a nurse in every family. And then we'd reduce emergency visits. General health would go up. And she graduated from St. Joe's. So I won't say how long ago. But she, so it's really good to be here, because it kind of feels like home. And Ted certainly made it feel like home. And I'll say one quick thing about palliative care, because it's a bit analogous to what, and Ted led to it, was leading into it in his opening. You know, we're here to talk about seniors, frail elderly seniors, and getting closer to the end of life. Maybe not at the end of life. But when I was doing, my father passed away about 3.5 years ago, and we went through a process of him dying at home and then at hospice, and then I began the work on the palliative care consultations. All the while, our oldest child, was pregnant. So our first grandson was born 9 months to the day that my father passed away. And so, which is, you know, it kind of gave you a pause for thought. And we were really ready for Vaughn when he came into the world. Like, everybody was, you know, like the nursery's painted, everybody's waiting, there's all this expectation. Schools are ready, healthcare's ready, we got all these tests, there's 30 immediate screens that we do, and then a whole series of other things. And so we're really ready at the beginning of life. The end of life, not so much. And so I try to inform the work that I'm fortunate to be able to do by keeping this in mind, is that, you know, the kind of care we provide for each other at the end of our lives deserves the same kind of attention as we give to the beginning of life. And that's what today's really all about. It's a piece in the puzzle of all of the things that we need to do to create good, healthy environments for people as they age, as they get older, as they get closer. We all know we all have a deadline somewhere. We don't know where that is, and we should all live well unto the end. So, for the last 2.5 years, our government has been working hard to deliver one crucial promise to the people of Ontario with respect to the delivery of healthcare. We're working to fulfill our commitment to put the needs of patients at the center of all decisions. That means ensuring that all patients have access to care at the right time in the right place. This has been a guiding principle we have followed as we have worked to transform our healthcare system to meet the needs of patients. Because the truth is that no one chooses to be in hospital. And if people had other options that better meet their needs, I think it'd be fair to say that most people would take a look at those options and choose those options. We know there are cases where home and community care may not be able to deliver the intensity of services that some patients need. Situations where a person can no longer return to their home because it is no longer suitable. They may need supportive housing that hasn't yet become available, or they're on a wait list for long-term care. So working with Mr. Hoskins, I know that our government has a commitment to addressing that need. So that is why I'm proud to announce the investment of $498,000 right here in Hamilton to support a seniors housing project. The initiative will provide both rent and home and community care supports, including assisted living for 40 seniors, allowing them to receive care in an environment suited to their needs. They'll live in residential units right here in First Place, Hamilton, and where they'll have access to a range of programs such as wellness and recreation activities. And I do want to mention that while we're talking about that, it's about wraparound care. There are people's medical needs, their care needs. There are people's social needs. There are their spiritual needs, their activity. Those things are things, their need for the other, their need to be in connection and to live in community, which is, I can see from coming into this building, that's what you've built here. Living in community is the strongest drug that we have to help solve or cure the greatest underlying condition, which is loneliness because of isolation. That is one of the key determinants of health. So living in community and the work that has been done here, and I know that Matthew Green's here, and when we have partners like municipalities and St. Joseph's Home Care, the whole St. Joseph's network, the LIN, local decision making, those things, it's critical to have all these partners, and that's what this announcement is all about. So we want to help all seniors find the care that meets their needs. That is why in the 2017 budget we set aside $24 million to support new innovative models to ensure patients are receiving the care in the most appropriate setting. We approached our partners in the 14 local health integration networks, and I know the Hamilton, Niagara, Haldeman, Brant. Lynn is here this morning, and I think is Donna with us? Okay, we already did that. Okay. I don't have Ted's list, so I should have had it, but that's my fault. To find new models to help us find those alternatives, because we rely on our local health integration networks for local decision making, building local partnerships. Everything can't happen from downtown Toronto. And I'm so pleased in the evolution of community-based decision making at the local health integration networks. And I want to thank them for all the work that they do. It's often work that you don't see. It's critical work in making sure that our healthcare system addresses the needs of the patient. So we're launching new programs like this supportive housing project across the province. Each day, Lynn's work with patients, families, community leaders, and local health service providers to plan, deliver, and fund local health initiatives that improve healthcare services for Ontarians. And they do it in communities from one corner of this province to the other. We know there are cases, pardon me, I flipped the wrong way. Our government appreciates local decision-making and service coordination is essential to the improvement and delivery of our healthcare system to ensure that it meets the unique needs of each community. So in keeping with our budget commitment, I'm pleased to be here today to have made this announcement with the projects that came out of the $24 million announcement that we made in the budget, and now we're speaking in different communities about how we're investing that money. So this investment is out of a $3 million set aside for rent supplements to help those seniors find a home that best meets their needs. The remaining $21 million will fund innovative initiatives for short-term transitional care for these patients who are waiting for appropriate living arrangements where they can still access the care that they need. We'll continue to work with our local health integration networks and our other local health partners across the province to find solutions that make sense in each of their communities. By providing appropriate care for these patients who no longer need the high intensity of a hospital, we're making better use of our healthcare system's resources. Still, and more importantly, we're doing our best for the patient. We're finding those patients who no longer need to be in hospital the appropriate temporary care and housing they require. These transitional settings are going to help patients regain their strength before returning home or finding a more permanent home, one that is more appropriate to their needs. And I want to conclude by saying it's really great to be here this morning, not because it's sort of kind of a semi-hometown, it feels like home, but to see the great partnerships. They are really critical to meeting the needs of patients. And I'm so pleased that there are so many of the partners that are here. Again, thank you very much. It's a pleasure to be here.
And at this point, please join me in welcoming Mr. Matthew Green, City of Hamilton Councillor for Ward 3. Thank you, Matt.
Thank you so much, Sonny. And on behalf of our Mayor, Fred Eisenberger, and Council, it's indeed my honor and privilege to welcome everybody here to the, I think, best part of the city, Ward 3. I can say to the honorable members present, thank you. Thank you for joining us. I can tell you with assurance, you have picked a winner here at First Place. And I'd be remiss if I didn't acknowledge our CEO for Hamilton Housing. I have the privilege of serving as the Vice President there and Treasurer. We have our CEO, Mr. Tom Hunter, and with him, Matt Bowen, two members of Hamilton Housing. And if I could go further and borrowing from my good friend Ted, be personal for a moment. In this room, we have an incredible presence of tenants here, neighbors, people who have been building community in this space for quite some time, in our Tenants Association, in our Team Dignity. And this may very well be the case of policy catching up to the grassroots and providing that wraparound community where we won't just be welcoming patients here into First Place, we'll be welcoming neighbors. And I can assure you with a full heart that our staff here, our residents and our tenants and our longtime supporters and volunteers will welcome these 40 units, as I understand, here in First Place with the grace and dignity that they deserve. So, Honourable Member, you are quite right, that our seniors in their last stage of life, and if I could be personal for a moment here, knowing that folks in this room have worked and supported their community members here through their last stages of life, will continue to do so with this significant funding, not just in the bricks and mortar of this building, but in the flesh and blood of our Hamiltonians here in Hamilton. We're so very proud of this innovative step that this government has taken, and certainly look forward to working alongside you and all of our incredible community partners, but most importantly, the community, the tenants here at First Place, the surrounding neighborhoods, and all the best that we have to offer, not just in Ward 3, but in the city of Hamilton. So on behalf of my neighbors and my neighborhood, I'd like to thank you for choosing First Place. It's called First Place for a reason. I can assure you you've chosen a winner. And to the honorable member, Mr. Ted McMeekin, I always know I'm in the right place when I see your name on the press release, because it typically means there's a significant amount of funding coming our way, and I thank you for that. And certainly thank all the staff and longtime volunteers who are here present today. If I was a minister, I would be able to take the privilege of doing the roll call, but I'm just a city councillor. I just want to acknowledge and welcome all the members here. So if we could just give all the residents and tenants a round of applause. The Tenants Association and Team Dignity, who started this work years ago and is now, this is what happens when government catches up to your good work. So thank you so very much, and thank you for being here today.
As a closing, I want to say that it takes a considerable amount of collaboration to find solutions to complex problems. I can speak for all of us at St. Joe's Home Care and St. Joe's Healthcare Hamilton that we appreciate the opportunity to support more patients to live independently in the community. This program is an example of how we can work together to provide community-based solutions to alternate level of care challenges by bringing together partners from our Hamilton-based hospitals, St. Joe's Healthcare Hamilton, Hamilton Health Sciences, the LHIN's Home and Community Care, and City Housing Hamilton. Thank you for coming today. Thank you to our speakers today for your commitment to improve our community. Thank you to the members of the media for your time and attention. Thank you to the team of people from various organizations who worked behind the scenes to prepare today's announcement. And finally, thank you to all of our guests who made the time today on their busy schedule to be here today. You demonstrate your commitment to serving patients in the Hamilton community and to solve some of the biggest challenges of our healthcare system through collaboration and partnership across sectors. At this point, I would like to invite members of the media to step aside for a question and answer session. Thank you.